just saw this new patient, and when I went out to the waiting room, saw there's a really cute little South Asian boy. He was sitting there with his mom.
So we're teaching these kids social skills using 12 sessions over the course of a group, right?
These kids don't have a regular prefrontal cortex. It works differently. How can you really generalize their effects?
Mom looked so scared. Like, what would she say if anyone found out that he was seeking treatment or was having mental health problems?
I mean, I'm thinking you can do assessments 3 months later.
So then you see what works in the lab, what works at school.
Exactly.
Work on that.
Yeah, but it's tough.
I'm a little nervous. I'm going to be leaving treatment in a few weeks and starting a new job. I really don't want to fall back into my old habits, but I'm worried about what people are going to think of me because I'm an addict.
It's very difficult at times to see kids who are ill and suffering.
When dealing with addiction, especially when it comes to transitioning back home, a lot of the things that you mentioned are very normal and they're really natural to be concerned about.
And, each day I just want to become a better clinician.
We need more providers that are, savvy about cultural issues and stigma. There's just much more work that needs to be done. I love my job because of the variety. I'm the director of the Consultation and Liaison Service at the NYU Medical Center, so I get to interface a lot with pediatrics and kids in the hospital. Scale from 1 to 10, 10 being the best focus ever, 1 being terrible. How's it been after the medicine?
7 to 10. Sometimes I'd say the minimum would be 4.5 or ish or something like that.
4.5-ish before the medicine?
Yeah.
I feel relieved to be working with kids because they bring such freshness and newness and awe to their approach to everything. I also get to teach 2 undergraduate classes, and then finally I have a faculty practice, which has been great.
One of the most exciting things about being in the Translational Research Center is you really do feel as if you're on the cutting edge of the field. What we try to do is take the knowledge gained from the basic science side, from the genetic discovery, and apply it to our clinical work in an effort to develop new treatments. The opportunity to go from teaching to clinical research is what keeps it always very, very interesting.
Even in the medical model, there's a stigma or a negative perception about addicts, and not until that I'm actually working with them on a day-to-day basis has it really changed that for me. Adolescence is such a pivotal time for the development of substance use problems. It doesn't happen usually when you're 40 or 50. It really happens in your early teenage to mid-teenage years, and if I can alter the trajectory of their life and in a positive way, I think that'd be really powerful.
My work with children in foster care has been the most pivotal, I'll just say, for myself. A lot of times they come with other stories that are even more tragic and even more challenging. But they come in, they bounce into your office, they really are remarkable. And from that's how I grow.
I'm going to be working at a hospital in Shanghai on one of the psychiatric teams. Every mental health system is different, so we're going to have to adapt and be flexible.
We're just going to walk this way to my office, all right? So, Ezra, after we met in the winter, you started coming here every week, right? You were doing that group here.
Yes.
Can you tell me how that was?
It was fun.
It was fun? Oh, good. I'm glad. Can you tell me a little bit about what you did in the group?
We earned tokens if we be polite.
Should I sit down or not?
Sure.
Yeah, sure. Oh, excellent. Look at that. You're sitting down now.
This actually reminds me of something funny.
Tell me.
Someone tried to go in a house in a video, but all the doors were locked.
As a physician, a lot of times I see these kids after some big crisis has happened. I know that we need to move in a direction that addresses these things before it comes to that moment. When I found out about this organization that does a lot of early intervention and reducing stigma, that's what kind of drove me to want to write an article about what they do.
We've been having trouble with Teo. We're just not sure where to go from here.
Well, have you spoken to his mother?
We have, but he still seems to be disinterested in normal activities and not responding.
So this is concerning because I remember Teo, and he was a very lively young man. So for him to completely shut down, something's wrong. How about if I start off the session today with just me in the room with him, and then we'll go from there and see what happens.
The first thing you want to do is be sure that you're building trusting, solid relationships with your overseas colleagues. For example, in Shanghai, what they needed was specialty training in psychotherapies. In Ethiopia, they needed resources and equipment. You really want to be building the infrastructure on the ground there so that once you leave, there's a platform for growth. There's just not enough of us to do this work, and so we need to think creatively about ways to work at prevention. It's important that we think on that population level.
I've really found that the back and forth between research and clinical work is what makes my work so exciting. We often talk about research as a way to ask clinical questions, to increase our knowledge and understanding of disease and help push treatment forward. I feel like I'm always observing and thinking about my patients in a way that asks questions. Then I hunt for answers, and it's always evolving. I felt very hopeful. There's definitely times where you see young kids and you can see right the moment in their development where things can divide and they can go down one pathway if they're not treated, or the other pathway if hopefully they are.
The kids are totally stoked about seeing you today and asking you a bunch of questions.
So guys, I'm happy to be here. It's been really nice getting to talk to you, get to know you guys, and I want to kind of jump in and get to hear some of your stories, or if you have any questions, that would be great. Yeah, Louisa?
Well, a while back, my best friend, she told me that she hasn't been eating, and when she does that, she throws up, and I don't know how to help her. What can I do?
It's got to be really tough for your friend to go through what you're describing, and it takes a lot of courage to ask it in front of everybody, so I'd love to talk about it a little bit more. I think kids deserve not to be judged, and when they come see me, that's what I'm doing. I'm trying not to judge them. I'm trying not to condemn them for their actions. I'm trying to understand them and accept them and work with that.
I actually did get a phone call from your social worker, and she told me that you had a tough week last week. You want to talk about it? So now what is this?
A stress potato.
A stress potato. Okay. Well, we're going to make a story about it, all right?
Okay.
As a clinician, you always have to be on your toes to be somewhat innovative. How am I going to engage this child? You know, what am I going to pick up with so that they feel comfortable with me and trust me so that we can then delve into the therapeutic process?
As a child psychiatrist, I feel excited about my work. I feel surprised every day.
I am someone that's able to join and partner in someone's life for a brief period.
I think I can actually help change developmental trajectories.
And hopefully let them go on, in their life without me. My goal is not to be there.
I'm grateful for the opportunities to work with families. I feel like it's really a privilege, actually.
I think you have to be a great listener. You have to be someone where you do really feel that you don't have all the answers.
I am part therapist, and I think part artist, and part scientist, and all doctor.